I'm excited to turn it over to our presenter this evening, Nevada Bennett. In her role as oncology support and family counselor, Nevada provides individual, group, and family psychosocial support to adults, children, and families affected by cancer. She joined the Wellness House team in 2020 and holds a Bachelor of Arts degree in psychology from Concordia University, Chicago, and a Master's of Arts degree in clinical mental health counseling from Concordia University, Chicago. She is a licensed professional counselor. Nevada is delighted to get to know and be a part of the journey of the participants at Wellness House. Her interests include reading, spending time with family, and enjoying new television series. So I'm going to hand it over to you. Thank you.
Thanks so much, Brittany, for the introduction, and I will share my screen so we can begin. Okay, everyone, everything looking good?
Yeah, it looks good.
So we will just hop into our agenda for today. So we will briefly discuss the types of blood cancers and common symptoms that are experienced, Scanxiety. We'll go over a variety of coping strategies and ways to increase support and discuss resiliency. And we'll have time at the end for Q&A or just to kind of give your comments and share some of your own personal ways of coping. So we will jump right into it. So we have, just to kind of do an overview about blood cancers. Blood cancers occur when abnormal blood cells start, growing, interrupting the function of normal blood cells and cell production. And these abnormal cancer cells greatly impact the ability for the cells to function the way that they should, to deliver oxygen to tissues and organs, to fight off infection, to help the blood to clot. So we'll just kind of briefly review the three main types of blood cancers. So there's leukemia, where the cancers found in the blood and bone marrow caused by the overproduction of abnormal white blood cells. Lymphoma is a group of blood cancers that develop in the lymphatic system, and then myeloma, for cancer formed by malignant cancer cells, typically originating in the bone marrow. So I thought it would be important just to acknowledge the experience of someone who's newly diagnosed and the challenges that come along with this transition. So just upon a cancer diagnosis, it's fast-paced, kind of introduction to the world of cancer. Soon, a person who's diagnosed can begin treatment, managing multiple appointments that are scheduled. And this really just ties into the next point of learning as you're experiencing, which definitely can be a challenge. For someone, they're learning as they're experiencing this journey, and it can be difficult to keep up with it. Learning medical terms and the function of treatment and services provided by varying medical professionals can feel like it's just all being thrown at you, and can feel very overwhelming, and it can continue throughout the cancer journey as new information is presented. And there's also concerns about lifestyle change, the impact on work, maintaining your household, caring for family, changes in personal relationships, also telling others about the diagnosis and figuring out the who, the when, and the how. So we'll talk a little bit more about that later in the presentation, about how to manage these types of conversations, because it can be a bit of a challenge and it can change throughout the cancer journey. And lastly, which is kind of tied into this shift in lifestyle, is how this will impact you financially. So there's many concerns, thoughts, anticipation that surface as a result of a cancer diagnosis and how to navigate this journey. So I thought it would just be important to include that, because again, it is a part of the process. So let's just kind of cover some common symptoms that someone with a blood cancer diagnosis can experience. And of course, symptoms can vary based on the blood cancer and the individual. So we'll just review some of those common symptoms that can, both have a physical and mental impact on one's well-being. So there can, someone can experience pain in their bones and joints, which can make it very difficult to manage everyday life and moving around and dealing with that uncomfortable pain. Also fatigue, which greatly, again, impacts your daily functioning, your energy level, the ability to do things such as even going to an appointment where if you have low energy, that can feel very daunting and very tasking. There's also the increased risk of infection. As we know, the blood cancer greatly impacts the functioning of cells and the roles of these cells and can make it a very scary experience. Also, difficulty breathing, experiencing weight loss, things that just feel like, not in your control can be very difficult to manage. And it can feel like another thing that's just not in your control. There's also unexplained bruising or rashes that can impact the way, how you feel about your appearance and can, lead to feeling a bit self-conscious. Also, headaches and dizziness, again, that feeling disoriented makes it very difficult to get through the day and take care of your responsibilities, make it to appointments and engage in some things that you want to do. Because again, if you're experiencing physical pain, it's very difficult to ignore that feeling. And also a possibility of swollen lymph nodes. So many of these symptoms can be uncomfortable and again, greatly impact daily functioning and can decrease your motivation in wanting to do things just because you're experiencing these symptoms. So I thought it would be important to just highlight some of the procedures that are associated with the blood cancer diagnosis. And again, just noting and acknowledging how this can have an impact on someone. So we have bone marrow biopsies, which are performed to evaluate and diagnose blood cancers and also used for monitoring during treatments. Blood transfusions are performed to give a patient healthy blood cells from a donor. And we know that the cancer itself impacts cell production, but also chemotherapy can impact blood cell production as well. And then also stem cell transplants, where the procedure in which the patient receives healthy bone marrow cells from a donor. So there's much fear, anxiety, and stress related to these procedures. Many people experience a kind of a procedural anxiety and can be triggered by, just anticipating pain or discomfort or fear of something going wrong. It can be helpful to learn more about the procedures from your care team and also being mindful of the impact of independent research and Googling, which can be anxiety producing. And just also recognizing that it's not a kind of one and done thing. Once you have your appointment, once you have this procedure, then the stress just vanishes. There's follow-up appointments to check to see how your body's responding. And with the stem cell transplant, there's a recovery process. And it takes a great deal of commitment and care and can feel very isolating with the need to limit contact with others. So just to recognize that procedures can be very taxing on your physical and mental health, and to recognize that there are ways that you can cope. And again, we'll talk about that further just in a little bit, but I think it's important to just recognize the different stressors that can take place. So I think it's helpful to talk about this word Scanxiety. I think many people have heard it. So it's an informal term. It's not listed in traditional dictionaries, but it's recognized by medical professionals and patients. So Scanxiety is defined as apprehensive uneasiness or nervousness, usually over an impending or anticipated ill, such as the anticipation of an upcoming scan or test to determine cancer growth or remission. So there can be anxiety regarding the actual experience of an exam. It could be leading up to the day of the scan, or it could be awaiting your results. So it can vary and it can be very difficult to manage at times because one experience isn't necessarily going to be the same. For a previous scan, you could have done well with managing feelings of anxiety, and then for another, it's a totally different experience. And it kind of brings up so many different questions like, will you feel comfortable, or will it, the scan experience be the same as before, and how you manage, and how do you manage these different types of feelings? And also just recognizing that scans measure progress. So there's much anticipation and uncertainty leading up to learning your results. And I think it's important to note that each person is unique. And again, it can vary from scan to scan. It can vary of who you connect with during the time. So just to highlight, I guess, some symptoms of anxiety, it could be anxious thoughts, difficulty concentrating, irritability, changes in sleep, and even tension in the body. So ways of coping with anxiety. One thing is to be mindful of what you read. It's very tempting to do some research and see what you find. Again, just to feel a little bit more prepared, but sometimes that can have a negative impact and make it even more anxiety producing, reading other people's experiences, and again, could have a negative impact and make you feel more fearful. So just being mindful of how close to a scan that you read, or even just how much can be important just to be mindful of. Another thing is to be mindful of who you connect with. So I think many of us can think about certain family members and friends who are really great about talking about a certain subject, and another is it can be a bit of a miss. So I think it's important to identify those people who, after you talk with them, you feel more relaxed, you enjoyed the conversation with them. Those are the type of people that you want to connect with during this time. And for those who increase feelings of anxiety or worry, might want to hold off on talking to them, at least about how you're feeling as you're leading up to your scan, because we want to limit the things that are going to be stressful and cause more worry. Another thing is distracting yourself with activities that you enjoy. I know sometimes when we hear the word distraction, it tends to have a negative connotation, but sometimes having distractions can be helpful. And it also just allows you to take a break from some of the thoughts that you have. And it allows you to, again, do something that's beneficial. So it can vary, but depending on the person and what your interests are. So thinking about an activity that brings you joy, that is, you can get lost in time. Those are the types of activities that you might want to ramp up a little bit more as you're getting closer to your scan, and just noticing some of those worrying feelings kind of surfacing. Another one is awareness of self-talk. So we aren't able to turn off our self-talk. We're always thinking about something. Before we do anything, we have a thought, but it's so automatic. Sometimes we just don't notice. So being aware of the things that you're saying to yourself and how you feel as a result of them. So sometimes we tend to lean a little bit more negative in a sense of thinking about what's the worst that can happen without looking at the opposite spectrum of what something that can go the way that we want to. So again, it's just awareness of the impact of our self-talk, because ultimately our thoughts are connected to the way that we feel, and that impacts the way that we behave. Another coping strategy is setting a time limit on worrying, which sounds a little bit different, but it's another way of kind of giving yourself a break from your thoughts. So again, like I said, we can't turn them off. So it's a way of kind of putting of having a protected time for you to get all those worrying thoughts off. So for example, you could say today's Monday at 8 o'clock. I'm going to do all of my worrying. I'm going to worry for 20 minutes. And throughout that Monday, that doesn't mean that those thoughts will just not surface because you have that specific time. But when they do surface, you can tell yourself, I'm going to think about that later. And you can do more than one time and say, in the morning, I'll have my protected time for worrying. And then in the evening, I'll have my protected time for worrying. And again, it's just to give you some space and a little bit of a break from those thoughts that can sometimes have that negative effect on you as well. Another coping strategy can be breathing exercises. It's something that you can do even at the time of an appointment, where you can just allow yourself to relax a little bit. Usually taking at least 5 deep breaths can be helpful, because our body recognizes that we are trying to decrease that stress response. So for some reason, if taking at least 5 is helpful, again, for just kind of bringing some of that relaxation, and it kind of kicks into gear our relaxation response. So now we're going to get a little bit more in depth about more coping strategies. And we're going to talk about increasing support, self-care. We'll talk about the 4 M's of well-being, and we'll talk about a variety of relaxation techniques. So we've covered all of the stressors and challenges. So we're going to spend a good chunk of time talking about how do we cope and what are some things that are helpful during this journey. So during your cancer journey, you may feel out of control, and self-care can definitely assist in giving you that sense of control as you get to decide what activities you want to incorporate in your self-care. The research suggests that regular self-care can reduce the adverse effects of stress, such as anxiety, sleep disturbances. As we mentioned earlier, that can also be associated with Scanxiety. So also the practice of self-care can reduce the influence of stress. So that helps addressing, your basic needs, and it encourages you to continue to engage in self-care. Keeping up with the self-care even when you're feeling good. I think a lot of times when we're feeling okay is a time where we take a little bit of break from these types of activities. But as you continue with them, just because, again, they make you feel good, you're doing things that are having a positive impact on your well-being, it only makes it better when you are faced with some difficult and some challenges as well. So some tips of self-care that I think are important to note include that self-care means taking time to do things you enjoy. We want self-care to feel good, not feel like a task or a chore, but it just kind of naturally fits in with you. So that's why it's really important to think about your interests, your hobbies, and what will you actually like to do where it feels like, oh, I can't wait to do this activity. Also, self-care means taking care of yourself. It's not selfish to do, it's necessary to do. So making it a priority is very important because, again, life happens and it gets pushed to the side and it gets pushed further and further down the line. And then it's been a while before you've engaged in self-care, and it can take a little bit more effort to kind of get back into that routine. So sometimes it's helpful to set specific self-care goals. And again, it gives you something to work towards, and it gives you some, motivation. And it really helps to kind of make self-care a habit for you too, because again, it takes practice for that to happen. And if you've been in a space where self-care wasn't, high on the list, it can take some adjusting to get used to, self-care and taking time for yourself. And I also want to note that a few minutes of self-care is better than no self-care. Sometimes it's hard to figure out time to do so. But again, it can be very basic. It could be, reading one chapter out of a book. It could be speaking, calling a friend and talking and, having a short conversation. So it doesn't necessarily have to be hours upon hours, because it could feel very difficult to try to squeeze in that type of time. But So if it's 10, 15 minutes, 30 minutes, it's still beneficial. So then we're going to talk about the 4 M's of well-being. So the first one is movement. We have meaningful connections, mindfulness, and mastery. So the movement one's pretty easy to understand. So getting up and moving, even if it's, going for a short walk, in a way connecting with nature or doing an exercise class, just doing some movement, even like cleaning counts as movement too. And especially if you're a person who actually enjoys cleaning, again, you're kind of reaping many benefits of it. But it's good for our well-being to get moving. And again, being mindful of what you're capable of doing is also important. So you're not overexerting yourself, but again, just doing it within reason of what you're able to do. Meaningful connections. So finding ways to have meaningful connections with friends, family, having that sense of community. And it's in our nature to like to connect with people, to share how we're feeling, or just to have a general conversation. It definitely is helpful for our overall wellness. And it's just a good time to talk and catch up. Another one is mindfulness. And mindfulness refers to engaging in activities that allow you to be in the present. So doing without judgment. And it can really allow you to tune into your senses. So, for example, you can go for a mindful walk where you're really aware of what's going on around you. You're noticing the sounds that you hear outside. You notice different things that you see, smell. So it can be the smell of grass. It's just really being in tune in the moment, doing your best not to be distracted. And with mindfulness, it's a practice. It takes some time to get used to really being focused in the here and now and not thinking about the past, not thinking about the future, which is just a natural thing that we do. We think about what happened or what's coming up. But you can find different ways to practice mindfulness in your everyday. It could be mindful eating is a thing where, again, you're really tasting the flavors of the food and you're really enjoying it and you're very present in the moment, not necessarily multitasking. There's even like mindful hand washing where, you can really feel the water and the soap. So it's so many different activities that we do or just daily things that we do where you can practice being very mindful and being present. Another one is actually mindful journaling too. So I'll talk a little bit more about journaling. And it's about, again, not having judgment, especially when you're journaling, you're expressing your feelings, your thoughts. I think it's pretty easy to kind of get into that mode of like, reflecting on what these thoughts and feelings mean. But again, it's just allowing yourself to have that time to express yourself independently, have that privacy, but it can be a very, I guess you'd say, mindful experience of just allowing yourself to freely express without any constraint. And then last is mastery. So that refers to improving a skill. So in a sense, mastering a skill. And not necessarily that you have to be the best at it. It could be something that you've always wanted to try. So again, you're just practicing in a sense. Or it could be something that you used to enjoy, an activity that you used to enjoy that you took a break from and want to resume and see how it goes for you. So it's really just dedicating time on improving, not necessarily having to be the best at it. So here is the wellness wheel. The wellness wheel can be used to create a self-care plan, and also the 4 M's, as we mentioned earlier, can help with deciding some of these activities to incorporate in your self-care plan. So this tool outlines 6 areas of wellness. There's emotional, physical, intellectual, spiritual, occupational, and social. And in all of these areas, they have little bullet points that kind of highlight what are some things that you can do to cater to this kind of slice of your wellness. So physical, I feel like that one is the easiest to figure out. Well, what things I can do, what activities I can do that can benefit me physically. So of course, healthy habits, nutrition, exercising, and physical activity all fall into that realm. And again, a little bit easier to figure out what you want to do. But if we take a look at the emotional slice of the wellness wheel, that's about managing emotions and in emotional regulation, having a positive attitude. It even includes mindfulness and gratitude in this one. So again, thinking about, well, how do you want to be mindful? Do you think mindful journaling would be helpful and cater to your emotional self-care? Expressing gratitude also can be one that, again, you can make it your own if you want to do a gratitude list or just kind of do just some light journaling, just to think about what are some things that you're grateful for. Again, it can be very different in the way that you decide to cater to this section of or this piece of your life. There's also social wellness. We talked about those meaningful connections from the 4 M's and communicating with friends and family and just connecting in general, sometimes even with people that you don't know. So you can still have connections. I think a lot of times when we hear that word of connecting, we automatically think about friends and family. But I think we can all think about an encounter that you've had with someone that you didn't know, but also had a meaningful result from it where you're like, wow, that was a really good conversation I had with this person that I've never met before. So it kind of it doesn't limit how your social wellness can be catered to. There's also occupational wellness, spiritual wellness, intellectual. And again, you can think about who you are personally, what your values are, what your beliefs are, and incorporate how self-care can look for you. And think about discovering new interests. And again, that might cater to the area of mastery, trying new things, and making goals. Again, things that are motivating to continue to do some things for yourself, because as I mentioned, self-care is all about you, what you like, and we don't want it to feel like a chore. We want it to just kind of naturally fit in with our lifestyle. So that's why it's really helpful, because you can cater it to who you are. I feel like we've heard plenty of different self-care activities, but ultimately you know what you like and what fits into your lifestyle. And we're just working to take better care of ourselves. So again, this is just a guide of things to consider as you're kind of creating your own plan of what you want to fit and how you're addressing your whole self. So next we have relaxation techniques. So relaxation techniques help with decreasing the stress response and really, amping up that relaxation response. So the first one we have is mindfulness meditation. So mindfulness meditation assists increasing your self-awareness as you tend to be very focused on, again, the present moment. That's the mindfulness piece. And you're really turning your attention toward paying attention to your breathing cycle and all the sensations that come with it. So really tuning in again to your senses. How does it feel to breathe? What are the movements of your body as you breathe? So you're very in tune with the process of breathing. Again, something that we do all the time, but you don't always notice the way that you're breathing. So this is a very intentional way of meditating. And again, just to really be in tune with the moment, noticing how it feels to breathe and how it relaxes you. Another one is guided imagery, and sometimes that's called visualization, where you picture in your mind different scenery and sounds. Again, it can be a mindful experience, and you picture. It tends to be like a place that brings relaxation. So sometimes it's a beach or like a very calming forest. So it can be something that you can picture in your mind. You can think about all the different details. And again, it brings about this pleasant, peaceful, and calm feeling. And it can be guided, or you can do it independently if you have like your own special place that brings you joy that you can really picture. It can be like from a past experience, like in childhood. I've heard some people, they can think about, a fun time that they had, and they can really picture all those details. And again, it gives that feeling of peace and calm. Another one is deep breathing. So again, this is being very intentional and taking in a good amount of air, holding it, and then letting it out. So there's the 4-7-8 method where you breathe in for 4 seconds, you hold for 7 seconds, and then you exhale for 8 seconds. And again, you just practice doing this. And again, this can be a mindful experience as well, but it also can just be a practical way of doing things. Again, like I mentioned earlier, if you're, feeling anxious or you have a scan or you're like in the waiting room, it's something that you can do in the moment independently, and it can help to relieve some tension that you're holding. The next relaxation technique is progressive muscle relaxation. And this is the process of tensing your muscles and then relaxing them. And this really assists in relieving tension. It helps you also to notice areas in the body that you're holding tension naturally. Sometimes the hands can tense up, even the forehead. So in this type of technique, you can literally start at the top of your head and move your way all the way to the bottom of your feet. Again, tensing different muscles and relaxing them and seeing how it feels, the difference of tension and that ease of the tension. And for progressive muscle relaxation, again, something that you can do on your own, or as you're learning and practicing, it can be guided as well. The next one is grounding exercises. And these are really interesting because, again, it helps you to be more in the present. And this can be used in collaboration with some other kind of coping skills. I talked earlier about going for a mindful walk, or even, you don't even have to be moving to have a mindful experience. There's the 5-4-3-2-1 grounding exercise where you can name 5 things that you see, and you're really just tuning into your senses. Like, what do you see, what do you hear, what do you smell, what do you taste? And it allows you again to be aware of how you feel, what you see. A lot of times, like even thinking about sitting in a chair, you naturally sit in the chair. You're not thinking about, well, I can feel my leg making contact with the chair. I can feel my feet on the ground. So again, that's literally you're kind of becoming connected with what's around you and what's supporting you. So some additional relaxation techniques, yoga and Tai Chi are both low intensity exercises. And with the movements, they help to reduce feelings of stress, can allow you to experience a meditative state, and can be very, very relaxing. And again, something that you can do with more people as well, and it can become a practice. Also, massage can be very helpful. So of course, scheduling a massage would be great for some stress relief, but you can also do a self-massage, and it can be done in conjunction with like deep breathing and some of these mindfulness techniques. And again, it can be something that you can do just a few minutes that can, again, relieve some tension if you're specifically holding like physical tension. So again, another type of relaxation technique. And then lastly, music. Music is so helpful. I think it can definitely boost your mood. A lot of times music is associated with different memories and different times that you've experienced. And again, it's, 3-4 minutes that can really make a big difference. So again, something simple that we have access to that again can decrease the stress response and just allow us to relax and just enjoy. So let's talk about increasing support. So connecting with family and friends, I think is just like a default. So we have access to, sometimes it's who we're most comfortable with, but again, that can vary. So thinking about, as we discuss this, who for you would be a good resource of support. You can also get paired with a mentor through Immerment Angels, and just allow you to connect with someone else with a similar diagnosis and treatment and ask questions. So it's good to just have that one-on-one and you feel comfortable because this person has also experienced what, a similar diagnosis and knows what the experience and the journey is like. Individual counseling can be helpful as well to process your thoughts, your feelings, again, one-on-one, and discuss topics that you may not be comfortable discussing with family and friends yet. Or it could be that you just don't want to discuss that at all. And again, that's okay. And also you can develop different coping skills and you also learn a little bit more about yourself in counseling as well. And then also joining a support group to connect again with others with a similar diagnosis, share your experience, share how you're feeling, and listen and exchange information with one another. It's just kind of that way of connecting with people who have a similar understanding where you feel, there won't be judgment, that they'll understand some of these experiences that you've had. Again, it can be a different experience than talking with family and friends who again can be supportive, but it's just a little bit of a different kind of connection. So these are just different ways of connecting with others. And it's something, again, might be something that you've never tried before, and maybe never tried individual counseling or join a support group. But it's to figure out what works for you. So let's talk about what's the benefits of increasing support. What does it really do? So it gives a greater sense of meaning, purpose, and fulfillment. It also increases that sense of belonging. At times, cancer diagnosis can feel very isolating, and you can feel that you want to kind of hold off on sharing or seeking support. And also thinking about who you are. For some people, they've always managed of being their own support system or knowing what to do, and it's a different experience to then seek support or receive support from someone else. But you can find that, during a time where you may not know someone else personally, or, among your friends and family that also experienced a blood cancer diagnosis, it can feel like, well, I don't have anyone to talk to. So then sometimes seeking those outside resources, such as joining a support group, can be helpful for you. And also, as I mentioned earlier, it's kind of human nature to form connections with other people. So it helps to benefit us. It helps with that social self-care slice that was a part of the wellness wheel. So it definitely benefits to talk with others. But again, finding who you feel most comfortable talking with. And it contributes to your self-care, as I mentioned, and not just the social piece. I think that's where we tend to, lump that in, but it helps with emotional self-care too, to be able to express yourself freely with other people or with family, with friends, in a support group. Those are all helpful in just promoting well-being, to allow yourself to have that outlet to release how you're feeling. And sometimes, saying things out loud doesn't necessarily change the circumstance, but it just allows you to feel that this is something I have control over what I say. I have control over my thoughts, and to be able to express them can feel very stress relieving in a sense, because again, you're not holding on to these thoughts again that we can't just shut off because our brains are always working. And it also helps to build your own internal resources. We've been talking about these different coping strategies and just building your own coping toolbox in a sense. And it also activates stress reducing chemicals in our brains. And in expressing yourself, it can help to, it gives you that good feeling of I've been wanting to say this and now I have the opportunity. I have people that are listening, and having a listening ear can go a long way. I think it's important to talk about managing conversations. I mentioned briefly at the beginning of the presentation about, when you are first diagnosed, how do you share that and who do you share it with and when? But I think it's something to note that it can change throughout your journey. So to note for yourself, who do you feel comfortable sharing with? And that can change. You have friends and family who you initially share it with, and maybe you find that it's not helpful to share, or you might want to wait to share. So, kind of keeping your communication open and honest, even if you decide I'm not going to share, I can still tell you that, telling family and friends, I need some time before I'm ready to talk about updates and talk in detail. And it can feel a little bit awkward having those type of conversations, but ultimately you have to think about how does it make you feel. And then if there are also identified persons that you don't wish to share with, you can practice what to say when people ask how you are. Sometimes you run into people who may know about your cancer diagnosis, or you may have shared briefly, and then they ask how you're doing, and you decide, don't really want to talk about that right now. So you can kind of come up with, and that's why it's helpful, like when you are talking with like other people, like in a support group, to see how did they manage this type of stuff, and what does it feel like to say that to someone. So it's good to feel prepared, because you don't want to be, thrown into a conversation and then you have to kind of make that decision in the moment, like, well, what do I want to say? So sometimes kind of having your own script of like, oh, if I'm not in the mood to really share right now, this is what I can say. But I think it's important to know that this is your decision. You get to decide who you share with. And if that changes over time, that's just something that that person has to respect, even if it's a bit uncomfortable. But you get to decide who you share with and how you continue to share with people. But again, for those who you do feel comfortable with, you know, keeping the communication open. If you have someone where you feel very comfortable sharing and expressing yourself, I say do so, especially if it feels good to talk with them. A lot of times with a cancer diagnosis, you find yourself trying to be mindful of what you share to protect others, and support. It's kind of like supporting them during this time. But if you have someone, again, who you trust and who's there just to listen to you, I say go for it and sharing and expressing again. So you're not holding that by yourself. Um, and you're allowing yourself to feel. I think it's important to note some coping strategies also for caregivers. As we know, a cancer diagnosis affects family, friends, and also those who hold the role of caregivers. So for the caregivers, recognizing your responsibilities, and all that you are managing at the moment, both personal and as a caregiver, it can feel like a lot to juggle. And also identifying stress triggers. What are some areas of your life that are feeling very stressful? And is it that you can lean on family and friends for support? Is it something that you could use help for? It feels like, when you're in a caregiver role, you get into like, well, I'll just do everything. And then sometimes you find that you do need some assistance. And just accepting assistance can be helpful, again, in decreasing some of that burnout. Also connecting with other caregivers and just sharing how this experience has been for you as well. Sometimes you can find for caregivers not wanting to put stress on their loved one that they're caring for. And again, sometimes holding back a little bit. but it can be helpful also to connect with caregivers and learn about some resources or ways that they are also managing being a caregiver. Also, taking care of your emotional and physical health is important. It's easy to kind of push that to the side and say, that can wait. But of course, in order to be, effective caregiver, you've got to take care of yourself, and also just to devote time for yourself to do something that you enjoy, or sometimes doing nothing is also self-care. I know we've shared tons of ideas of what self-care can look like, but sometimes the absence of doing things is also self-care to give yourself a break. So let's talk about resilience. So what exactly is resilience? So it's really just defined as adapting well in the face of stress or difficult life events, with a cancer diagnosis being, one of those life events. I think it's everyone's personal decision if they want to bounce back or bounce forward. So we can just talk about some of the key components of resilience, what promotes resiliency. So some of those key components is facing fear and recognizing like your fear is appropriate. It's okay to feel fearful. Also being optimistic, realistically optimistic. So focusing on the positive without denying the negative. So being able to balance both, that, this is the way that I'm feeling right now, and it's okay that I'm feeling this way. I'm not always going to be happy, but I can also take some time to notice some things that are going well. Also self-awareness, so recognizing what makes you unique. When again, we've been talking about self-awareness and being present with yourself, with your thoughts. But it's definitely helpful because again, you learn more about yourself when you pay attention to yourself. And we've talked about mindfulness, being present in the moment, and just actively noticing and not being judgmental of yourself in the process. Just to continue on, self-care, we've talked about in length and how that is just helpful in thinking about us as a whole person, our well-being, and what are some things that we can do to care for ourselves and dedicate time for ourselves. Also, relationships, connecting with other people, changes in relationships, hopefully for the good and building resiliency, but how those can change over time, and also expressing gratitude. So hunting for the good stuff, what went well. And I think sometimes even with gratitude, it can be a little bit harder to seek that or to see how that's present in your life. And it takes a little bit more effort. But again, it's something that you can take note of that can make you feel good. Another one is maintaining a sense of humor. Laughter is good for us. It feels good, and can bring about just a happy feeling. So whether it's, watching a movie or talking with a friend or whatever it is that, can just bring about a good laugh. Just remembering that it's helpful to keep that humor. And then lastly, having resilient role models. So having those examples or even past experiences that can help with kind of promoting resilience at this time. So, who in your life is that person, and how have you seen those people demonstrate resilience? So I thought we could practice a little bit of gratitude, help with our resilience. So I want you to just take a few minutes to answer the following prompt. So what are two things that you're grateful for today and why? So if you want, you can write it down or you can just think about it, but just take a few minutes and just reflect on how that experience is for you too. We'll take about 1 more minute. Okay, everyone. So thanks for trying that out, and hopefully we're able to think about some things that you're grateful for today. And again, something that you can incorporate into your routine, not necessarily having to do it every day, but just sometimes taking a moment to think about what you're grateful for. And again, it's just about promoting resiliency, and it feels good to think about things that you're thankful for. So just wanted to highlight some of the Wellness House support groups that we have. We have the Leukemia Lymphoma Support Group that meets on the second Thursdays from 7 to 8:30. The Multiple Myeloma Support Group that meets this week. So that's on the third Thursdays from 7 to 8:30. And then we also have the Scanxiety drop-in group that meets every Mondays from 3 to 4:30. When you do have like an upcoming scan, you can come in and just express yourself and learn different coping strategies. So if it's something that you're interested in or want to try out, these are the support groups that might be of interest. And then also just sharing our program guide. We've talked in depth about stress and coping and self-care. So maybe finding some classes that will assist with that, to not only connect with other people, but to also learn and also be able to do some activities that are very relaxing, some meditation, some Tai Chi, some yoga. So when you get a chance, you can look and take a peek and see if anything is of interest that you want to try out. Again, just for addressing the whole you.